Hello and welcome to this my 20th CPD Coffee time with me, Dr Tina Rae. Today we're going to focus on understanding and supporting the well-being of the girl with ASD in today's so-called girls' world. Many of you will know by now, hopefully, that I'm currently working as a psychologist, a consultant psychologist for Campus Fostering. I was also previously a teacher and I write prolifically. Many of my publications you will find with Nurture UK, my favourite charity. And I'm really committed as someone who is very focused primarily on the well-being and mental health of children and young people, to providing resources that are really practical and user-friendly with a really good evidence base. I also clearly write for Hinton House Publishers, and you will find many of my resources, most recently with them, have also focused on specifically this area of building resilience, well-being, mental health. The one resource that I'm going to make reference to primarily today is the ASD Girls Wellbeing Toolkit, authored by myself and the wonderful Dr Amy Such, a former student of mine at University of East London. And we're really proud, obviously, of this book. It did win the Best Education Resource at the Best Awards this year. So in today's session, I'm going to think about some of the key concerns that we have, both for those girls on the continuum and those who are not on the continuum. There are lots and lots of issues, primarily to do with the misdiagnosis or no diagnosis of girls, and I'm going to touch upon those at the start of this presentation and point you primarily to the work of Professor Francesca Happe. I think that there is a need for us to engage with girls on the autistic spectrum to actually identify their concerns, and I think there's something about listening to the voice of the child that sometimes goes awry. We miss it. We kind of think we know what they need when actually we need to be asking them this. So we need to engage with them, and also those who care for them as well, to think about what appropriate support systems and strategies need to be in place, what really does work for them. I'm also very much focused on this notion that prevention is better than cure. We need to actually get in there early, because there are so many girls and young women out there, not just those who are not being diagnosed appropriately or in a timely fashion, but also who actually, because of the way in which their difficulties are not being managed effectively or addressed in the school context, are suffering high levels of anxiety. And obviously that impacts massively, hugely upon their mental health and well-being overall. So we need to protect that mental health and nurture it in the right way. I think we need to really teach effective thinking, so that there is something about enabling girls and young women to really distinguish between the real traumas, the real stresses and everyday stresses, if they're going to survive, if they're going to actually manage to navigate this really complex social system in which they find themselves today. And we know that for many of our young people, there are very significant issues with depression. The figures are pretty horrendous, I feel. We know that the average age for onset for depression, for example, in 1960, when I was born, was 29. It's now 14, and we're seeing many more girls aged between 14 to 16 requesting support via CAM services, via their GPs, etc., in order to actually address some of the high levels of anxieties that they're experiencing. And we know also that the rates of self-harm are a significant concern, and again, there's a direct link between levels of anxiety, girls who are on the continuum, and engaging in self-harming, eating disordered behaviours. There's a direct link between those, obviously, and that's something, again, that should be of a concern, real significant concern to all of us. So for girls on this so-called spectrum or continuum, there is a huge issue. We know that girls with undiagnosed autism are painstakingly copying some behaviour, and it's not picked up and therefore any social communication problems they may have are also being overlooked, because they're very good at doing this masking, this copying, this replicating, and this kind of mimicking and repressing of their autistic behaviour can be absolutely exhausting for them. And I think, as your Smith suggests, that there is perhaps a direct link here. What it results in is really quite high statistics of women with mental health problems. So we know that if autism in girls remains undiagnosed, they are at high risk of developing mental health difficulties, including anxiety, depression, self-harm, and eating disorders. And of course, that's going to have a significant impact on their ability to engage academically in the learning process, and also, ultimately impact negatively upon their ability to achieve their full potential. And as I said earlier, the issue here is quite clear. Diagnosticians can therefore really perceive some of these girls and young women who are very good at acting neurotypically, and many of them in social situations. So they would present as able, reciprocal conversation. They have got that, apparently, and they can use appropriate affect and gestures. And this would mean that they would not actually fulfill the criteria presented in the international classification systems. So this is clearly a direct result, would be that they are being missed. Girls and young women are left to adopt what Yale Smith called social rules, which are based on intellect as opposed to social intuition. And that kind of camouflaging that they engage in, alongside this repressing of their autistic behaviour, is really, really tiring. So I think there is a real direct link here, and it can't be emphasised enough. So, as Terry Brugger asked, what are the questions we should be asking women and men, and what observations could we make to help answer this question? Are we missing autism even more so in women than in men? And for example, part of this answer might be to ask people more probing questions about their possible repetitive behaviours and sensory difficulties or differences. And we have to think about what our knowledge of the epidemiology of autism in adulthood and from growing referrals of women to an NH clinic actually teaches us already. And we know that this false positive diagnosis of autism in men can include men who are poorly socialised, for example. And for some men, they're less concerned about how they present, appear, and are probably less verbally competent. We could pose the question, is it because to some extent women are more biologically protected? There's greater concealment because a diagnosis could also compromise their freedom to choose to be a mother, for example. Again, this is coming from the work of Yale Smith. Is it possible, we also don't know, that women on the spectrum are more likely to be in a sexual relationship than men? And again, that could provide them with greater opportunities to learn how to be socially responsive and responsible, and even seem, quotes, and I quote, normal, neurotypical. So I think that there are some key questions there, and things that need to be reflected on perhaps a little more deeply. And also, when we're thinking about this misdiagnosis or non-diagnosis, we need to perhaps reflect more upon the repetitive behaviours as well. Could it be that there's a greater range of routine repetitive behaviours that girls and women engage in which go unnoticed or even appear normal? So if you're thinking primarily here about domestic roles, employment roles, outside interests such as caring for animals, for example, that appear normal, neurotypical? Could it be that we don't ask about interests that are commoner in women? And I think this is a key one I'm going to come back to again in a minute. Is it more okay to ask male gender specific interests than those that might be commoner in women, for example, food issues, dress, makeup, celebrity, adulation, etc.? So when thinking about the assessment process, if we would perhaps have previously been asking, do you have special interests, for example, involving history, technology? Well, we need to revise that then to think about, do you have special interests, for example, involving history, technology, food, animals, fashion, body adornment, jewellery, makeup, tattoos, symbols, people who are famous, celebrities? And interestingly, when we ask about people who are famous, very often someone will come up with an individual, and the girl that I may be working with will have identified the fact that they have 20,000 individual photos of that particular person. They've got a real obsessive interest in that individual. So I think it's about what girls have and have not been answered and I've asked. And I think as well, there's something here to do with the fact that the actual assessment tools were not primarily fit for purpose. So if you want to find out what really is beginning to work and is more effective, I would suggest looking at the work of Francesca Happe and her colleagues in terms of assessing the young woman's ability to mask, and also just producing more relevant assessment materials and resources for this particular purpose. But perhaps as well, we need to just reflect slightly more deeply here in that if it was the case that these so-called higher functioning women with autism are missed more often, partly because they're managing everything better, would it matter if they were missed more? After all, most people in adulthood with autism are missed anyway. And where do we actually draw the line here? Some say that having autism isn't actually what matters, and that they would not want to be different. So what does matter in essence? I think from my perspective as a psychologist, having worked with children and young people for so many years, what I would say does matter about not having this diagnosis is that there's far greater risk of the child or young person being excluded, suffering higher levels of prejudice, bullying, restricted functioning, lower income ultimately in the longer term due to less academic achievement, and greater stress and poorer life quality overall. So those factors for me would really push me in the direction of saying that I really do think there's something very valuable about gaining this kind of label or assessment, because it would ultimately, or should ultimately, make a difference to the kind of provision and support that's available to each individual girl or young woman. And of course, there is this whole notion, this area of mental health that is so important. We know that girls with autism are more likely to develop mental health problems such as anxiety and depression. And in terms of pointing you to what I would call a seminal publication on this particular topic, I would recommend this from Routledge, edited by Barry Carpenter, Francesca Happe and Joe Egerton. So Girls and Autism, Educational, Family and Personal Perspectives. And what's very valuable and unique about this publication is the range of different contributors, from parents through to psychologists, through to specialist teachers, through to individual children, young people themselves, talking about their experiences from a personal perspective. And of course, I have co-authored a chapter in this book focusing primarily on mental health of girls on the autistic continuum. And one of the arguments that I make in my chapter is that I do feel very strongly that the girls need to have access to this diagnosis if they're going to then ultimately receive the right kind of support for their mental health and overall well-being. And this is a lovely quote from the Spectrum Girls Survival Guide, How to Grow Up Awesome and Autistic. And it probably says it in a much more profound way than I could as a psychologist. My autism diagnosis finally gave me the answer as to why I'm different. I was no longer shy, timid and eccentric, or worse, weird and odd. I was autistic. Autism. A 6-letter word explained everything. So thinking about some of these characteristics, and I'm thinking primarily about some of the work from Sarah Wild at Limpsfield Grange, and these are two of the girls from a report in The Guardian, talking about actually what are the differences, what are the qualities, what are the exhibiting behaviours. And these are, again, clearly they're on a continuum. We can't totally generalise. We can't totally generalise about any special educational need. The female mathematician, so someone who's really fond of her subjects, disregards girly activities such as small talk with girls and friends, finds that incredibly difficult, doesn't want to engage in that, really actually tires her out. The Asperger's fashionista, so the impeccably dressed and groomed individuals. So she's got a very good grasp of small talk, but it's copied, mimicked from others, and really struggles to make that kind of subtle social contact. So again, having to try and do that is really exhausting. And then one which I found kind of quite relevant to lots of individuals that I have worked with over the years, this Asperger's cook, the notion of this domestic goddess. So rather than actually engaging with the social aspect of entertaining her guests, sitting at the table, having conversations, making the so-called small talk, as we might call it, would be in the kitchen making sure everything was absolutely immaculate, but have to go in between courses and clear up, etc., because it didn't want to actually be available to others or make themselves available to others in terms of socialization. However, I do think it's really, really important just to factor this into our thinking now. And I'm not sure where I actually got this wee diagram from, so I can't credit it, but it's very, very useful in terms of actually ensuring that we don't make simplistic assumptions about autism spectrum, because for many people, it really is far more complex than actually just thinking about being less or more autistic. So when I refer later in this presentation to I make reference to the so-called spectrum, it's not because I don't think there exists this difference. It's just I think it can be quite limiting, and I think very often this is so multifaceted, impacting upon language, motor skills, sensory issues, perception, executive functioning, and the girls themselves and the boys themselves who are autistic are very, very different. So I think it is important that we don't lose sight of that complexity. So although we have these stereotypes of the fashionista, the perfect cook, etc., in terms of ASD, I think we have to just be very careful that it is very different for different individuals, and not to lose sight of that complexity. And for some who may have really highly developed language skills and be socially quite competent, what we need to actually really factor into our thinking is that they might also find that extremely challenging and really, really tiring to actually maintain that in the social context. Whilst also for some children, young people, they will find sensory issues hugely dominating in their lives and far more of a problem than actually being in a social context. So just not to lose sight of that at this point in the presentation. And also thinking about issues into adulthood as well, just that whole thing about your general appearance. And as Temple Grandin said, men and women are judged differently when it comes to appearance. Men who appear grungy, archaic in their fashion sense, or just eccentric are usually excused for this shortcoming. But a grungy, unkempt or strange-looking woman is considered a spectacle. So I do think that the issues are long-term for many. So I want to put this notion of the ASD girl, diagnosed or not diagnosed, having to actually contend with the social context that she finds herself in today's really, I think, kind of complex social, emotional and educational world. And I think there are concerns that we have as psychologists for all our girls. And I'm going to just talk about a few of them as we go through the next slides, including relational aggression, that girl-on-girl bullying, early sexualization, unsafe sexual behaviors, drug use, alcohol use, runaways, gangs, levels of self-harm, self-injury and eating disorders, and this kind of real fashion currently for plastic surgery, tattoos, etc. And overall just concerns around self-esteem, body image, confidence and well-being related to the plethora of media images and resources which purport to show the perfect woman, the perfect girl, human being. And given that those are, from my perspective, issues for all our girls, I do think that we have to very much then question, how do the ASD cohort interpret this and navigate what I call a social minefield? Robbie did a huge amount of research. It's 20 years ago now, still extremely pertinent to today. In fact, more so than ever, I think, with the advent of more increased use of the internet and iPhones, etc. She illustrated how girls' youth culture is intrinsically linked to specific magazines, and magazines now available online, of course. She stated that the messages which these images and stories together produce are both limited and ambiguous. And sadly, it's almost, from my perspective, as if feminism hadn't occurred or existed, because these magazines and the online resources that girls are now accessing still primarily put forward these key messages subliminally underneath everything that they are putting forward. There are these messages being pressed and impressed to the girls and young women. The girl has to fight to get and keep her man, sadly. And that means, of course, that she can't trust another woman. So another girlfriend is competition, actually, ultimately. And that romance and being a girl are fun, or it should be fun. She must always also look good. She must look perfect. She must look wonderful. And these are really, really so, I think, essentially anti-feminist, I suppose, but it's the messages are still out there, and girls who are young teens still haven't formed their sense of self. They're adolescents, and they are so impacted upon by hearing this stuff, seeing this stuff. The American Psychological Association back in 2005 was so concerned about the sexualization of girls that they formed a task force to look at this as a real issue. And they found ample evidence for the sexualization of girls and women on TV, music, lyrics, sports, media, video games, the internet, advertising. And there's a seminal study, which is very old now, but very much still pertinent to today. O'Donoghue, Gold and Mackay, they coded advertisements over a 40-year period. So it's a longitudinal study. I don't think we've had one that's been this extensive before, but they found 85% of advertisements sexualized girls as opposed to boys. And also that girls sexualize themselves when they think of themselves in objectified terms. So they learn to treat their bodies as objects of others' desires, primarily boys and men. And also there's an issue here around us as parents, carers, thinking very much about our narratives around our girls. And many parents, carers still will possibly be presenting girls and young women with the message that being physically attractive is one of the most important goals for them to achieve. And some will provide access to plastic surgery in an attempt to reach the ideal. And sadly, in my most recent experience working with 3 girls in my local vicinity, I would say that there has been some huge issues around them getting their lips pumped up, tattooed eyebrows, which is very common now, but also this whole notion of actually improving their bodies to gain this level of perfection. There has also been research to show that teachers themselves can also encourage girls to play at being sexualized adult women, or maintain the belief that girls from specific ethnic backgrounds are hypersexual and therefore unlikely to achieve any academic success in school. And sadly, although this seems totally outrageous, I'm afraid there is still evidence of this in some areas. And it's also evident that male and female peers contribute to this process as well. Peer pressure from both genders, male and female, has been found to contribute to girls conforming to standards of thinness or so-called sexiness. And I think the key concern here is also the particular ways in which the process encourages boys to sexually objectify and harass girls. And this behaviour is also normalised by the girls themselves, by this process of self-objectification. So they begin to think and treat themselves as objects of other people's desires, as I said previously, but it's this normalization of this. It's almost something that becomes accepted. And also there's this notion of the ideal, the perfect woman, which, you know, that they are being bombarded with these images. So just keep thinking all the time as I'm talking through these issues about how the girl on the continuum, how does the girl with ASD interpret all of this and navigate this? And is it harder for her? Is it more difficult? Does it increase levels of stress and anxiety? Because there is something about this self-obsession, this obsession with something being the perfect thing, the perfect being, having control over that. So in order to actually look like the model, I will have to reduce my calorie intake. And what this does as well, that there is an increase obviously in eating disorders, and I think what it does as well for the girl on the continuum is gives them a sense of autonomy, because I know for an absolute fact, talking to many girls and young women with ASD, that they talk about eating disorders as part of being who they are and as part of something they needed to do in order to be able to manage to feel in control. So really being in control of what they didn't eat gave them a sense of power and autonomy. I also think that there is real concern, which is continued, about girls and young women having breast implants at an increasingly early age. And I did work with 3 young women, this was a few years ago now, whose grandmothers had been providing them with the funds so that they could go to America at the age of 16 to have these breast implants, which is hugely concerning, and is something that we mustn't brush under the carpet at all. We need to be really talking about this in the open and challenging this. And we also know that exposure to gender stereotypical ideas and images also contributes to sexist attitudes and belief, and sexual harassment and violence as well against women. And I think this is really, really important that we really factor this into our thinking. We talk about this with our girls and young women. Objectification in this way can enable and encourage a range of oppressions, which includes employment discrimination, sexual violence, and the trivialisation of women's roles and accomplishments in the workplace. And this increasing availability as well of pornography, due to the advances in technology, what children are actually looking at and downloading on their phones. That's also a contributing factor in this increase in acceptance of sexual aggression within relationships. And we need to keep asking ourselves, so how does the girl with ASD make sense of all of this and navigate it? And how does this particular issue affect the boys? The NSPCC'S survey, 2015, so 5 years ago, still hugely relevant. They surveyed 700 children and young people aged 12 and 13, and 1 in 10 of them said they were worried they're addicted to porn, and more than 1 in 10 had made or been part of making a sexually explicit video. So there are huge issues here about children feeling that watching porn made them depressed, give them body image problems, and they felt pressurized to engage in sexual acts they were not yet ready for. And I've talked to ASD girls who said this certainly was the case for them, and they also felt that they learned how to do these sexual acts by watching pornography. And this, in a way, made them feel more in control because they thought they were doing the right thing. And I think this is a huge, huge issue. And looking at this, that the website Pornhub was amongst the top 5 favourite sites for boys aged 11 to 16. This is from the charity Childwise's survey. And that raises huge issues, because if you do know what's on Pornhub, you'll be very well aware that there's very little on there that is anything to do with consent. I call this the Elizabeth Hurley effect, and slightly tongue-in-cheek here, but it's not really. I'm making a very, very serious point. If you look at this image, just stop for a moment, stop the recording and just have a look and say, what does that make you feel, knowing that the little girl on the left is, I think, about 3 years of age. There is something about the positions, the way in which they're standing, looking at the camera. I think the girl in the little purple bikini doesn't look particularly comfortable at all. And there's something here about sexual objectification in the raw. What was very positive, of course, was that there was such an outcry that Elizabeth Hurley had to take this range of swimwear off the market at the time. And quite interestingly, this is my sister, my little sister, on the beach in Swanage in 1964. And I would suggest that that is possibly a more appropriate form of swimwear. She's actually got a t-shirt on because we didn't have suntan lotion in those days, and we're both very fair. And here's my mum, who's now 93. She's in the middle, of my sister and myself, flossing my hair up, but I would suggest in a way that is not sexually objectified. I'm not objectifying myself in any sense, I don't think. And I don't think the costumes are remotely sexual. I think they're just very retro, which is great. I'm glad retro is coming back into fashion. And what this says to me really is that the only person there who looks sexualized is my mother, because my dad's taking the photo and she adored him. But how interesting is that? That's appropriate. And I think we need to just take a bit of time to pause and reflect and look at our own levels of behaviour. What are we doing? How are we encouraging this? Are we challenging it? Or are we giving in when our girl says, I want to look like that, I want to have that outfit, I want to wear this, mum? I think we need to be really, really thinking a bit more deeply about it and challenging ourselves to make the challenge and to put some clearer boundaries in place. So as I said, swimwear designs for girls circa 1968, and here I am in the middle there, forever tall, but with those wonderful little retro swimwear, those suits on there, they're fabulous. So all of these issues, the consequences, there is the effect on adolescence, on girls and boys, are strong. They really are still forming their sense of self, and we know the research links sexualization with 3 of the most common mental health problems in women: eating disorders, low self-esteem, and depression. Also, the consequences are increased sexual problems, diminished sexual health if children are encouraged to engage in sexual activity at too young an age. It places attractiveness at the centre, or it presents it as being of most value. That's what really matters about you, how beautiful, how good looking you are, and also increases sexism and rates of sexual violence towards women. And of course, issues of relational aggression, as I said earlier, are still an ongoing concern. Wiseman, way back in '95, said she'd realised that the relationship between girls was directly responsible for creating the low level of self-esteem that leads women ultimately towards abusive relationships, unwanted pregnancies, drug and alcohol addiction, and a whole subset of poor self-image manifestations from anorexia to bulimia. I think there's some truth in that, but I don't think it's all. I think there are lots and lots of other um, issues for girls and young women now, not just those relationships between themselves, but I do think we need to actually be very clear. This is something that does continually need to be tackled and challenged and raised. What we want our girls to be are empathic, supportive, and to challenge the stereotypes and to challenge behaviours that are bullying of each other ultimately. We also, I think, need to be challenging this notion of mobile phone usage as well. Most of the bullying that I have witnessed between girls has gone online, or it's on their mobile phones, posting images of each other. So this hypervigilance around, I'm not going to sleep tonight, I'm going to be under the bedclothes with my mobile phone on, checking to see what someone's actually said about me so that I can be prepared for it the next day when I go into school. And that's incredibly sad. And I think as well, as adults, we need to look at our own use of mobile phones and our own behaviours and how we're modelling this to our kids. Do we actually make limits? Do we actually make some rules around mobile phone usage, internet usage, and limit time? And I think that there is a real argument for saying we need to really think carefully about this and put some more boundaries in place. And once again, how does a girl with ASD make sense of all of this? I've worked with girls on the continuum who are so obsessed with their mobile phone, they never really have it off, and their social media profiles are absolutely vast, and they are so over the top and get so upset and so anxious if they don't get the likes. It becomes something really, really obsessive. And so from my point of view, we need to be thinking about how we protect them again from this. In order to understand a person, you must understand what that person understands. So we need to know what that ASD young woman, that girl, is thinking and feeling, and how we can support them. And we need to be able to have that open communication with them. We need to understand, we need to seek to do that, because we need to use their understanding to find some solutions. And one of the issues, of course, was sexuality, because this was the biggest risk. I was working, this was about 10 years ago now, with a group of girls who I would suggest over half of them were on the continuum and had a diagnosis of ASD. And they were all at risk of being groomed sexually online, and they were all at risk of engaging in, or being the victims, I should say, of child sexual exploitation. So we developed a girls group, and primary focus of this was to teach about sexuality, which I felt was a total essential. So making sure that we realise what was public versus private behaviour, what was okay, what was good touch versus bad touch, and how to say no, particularly using proper names for body parts and what the slang names were, creating and being able to maintain personal boundaries, masturbation, the whys, the wheres, and the hows, but also keeping yourself safe again here, social skills, relationship building, and avoiding danger and preventing these children, because I say children because they were children, they were all 14, 15, they're children, trying to protect them against abuse and being exploited. So also relationship skills and this concept of consent, what that really, really means, and your personal responsibilities and values and how important those are. So these were just some of the areas that we would be touching on. And I do think that they should form part of every girl's support network going through her teenage years. So what are we really trying to prevent? And I think maybe just stop and pause and reflect a bit here, because I think you could probably jot down a number of issues around mental health, sexual exploitation, low self-esteem, job prospects in the future, finishing education, access to services such as CAMS, and obviously what we're really trying to prevent, I think, is self-harm, eating disorders, etc. And children and young people's mental health, it is one of the most challenging mental health issues of our time. It's one of the most challenging health issues. It's estimated that half of all mental health problems emerge before the age of 14. So from my perspective, this is why we need to get in early, using effective evidence-based interventions with children, young people and families, because we can avert some of these awful consequences. And we know nearly a quarter of 14-year-old girls self-harm. That's 25%, a quarter. And I think we need to be very, very clear that this is not just the remit, the premise of the girl on the continuum. This is all our girls. And I think that we've got to be very, very careful that we actually educate around this issue and we provide the resources to prevent the problems from escalating to this level. We know that hospital admissions are going up, both for boys and girls. We know the most common form of self-harm is cutting. And we know from the anonymous surveys that 1 in 10 young people have tried to hurt themselves at some point. And they talk about family difficulties as being the main reason, followed by body image and work or school pressure. And that is consistent for all our young people. And it's this sense of isolation, I think, that is probably one of the key factors, particularly for those on the continuum. If they're thought or felt to be different, if they're being bullied, if they're being ostracised from the main group. But also, I think this is when children and young people do tend to engage more in social media, because the internet is a very safe forum for them to some extent. But it's a very safe forum from their perspective. We know ourselves as adults that it clearly isn't. There's a lot of stuff on there that is actually quite triggering, particularly in terms of self-harming behaviours. And if you look back at my session on self-harm, and please do if you want to do something in parallel with this, I do think that I talk in more depth about the self-harm websites there. But I make the very, very strong argument that they are very, very damaging to our children and young people. And the need to access these kinds of blogs, these sites in particular, usually young people will be saying it's because you don't understand. So this seeking to understand their perspective, their experience, who they are, for me has to remain our primary focus. So navigating the complexities of this context, as I've said, is really stressful for all children. But for those with ASD who are on this continuum, who don't necessarily have the skill set of analysing and accurately interpreting the content and behaviour of other users, to manage this without experiencing high levels of stress and anxiety is virtually impossible. And the difficulties include anxiety disorders, social phobias, self-harm and eating disorders. And I think one of the main problems of most concern to many professionals has been the prevalence of self-harm within this group. So really, really important that vulnerable populations such as girls with young women with ASD have the necessary support to effectively manage and maintain their own well-being. And this is from Crane et al. And Simonoff et al. I think it's really, really vital, given that we now have this awareness of the increased risk of raised levels of mental health in those with ASD generally. So for those who are at risk of mental health problems, we have to have effective screening tools in place and use data effectively and have an effective pastoral team in order to support the children and young people who are most at risk. So the mental health leads now in schools primarily need to take this key role, looking at behaviour records, attendance records, attainment levels, changes that can then be monitored, and we can identify children earlier. So using assessments such as anxiety scales, using assessments around emotional literacy, mood and feelings questionnaire, etc., etc. There are lots and lots of different tools and resources that we can be using now. And from my perspective as a psychologist working with children and young people, there's a real need, a continued need to focus on interventions which support the development of self-help and self-management strategies. So I know that specific therapeutic approaches, including cognitive behaviour therapy and tools from positive psychology, can be adapted for use with girls on the autistic continuum. And I point you again to my sessions on CBT and positive psychology if you want to find out more, particularly about these processes and interventions, which of course are evidence-based. And as part of any process of supporting and developing and protecting, maintaining mental health and wellbeing for the ASD girl, we need to think about this notion of normalising stress. We know that tension and stress is a normal part of everyday life, and to some extent it's a necessary one if we're going to effectively grow and affect change. We need to have some level of discomfort and anxiety around learning new things if we're going to really focus and adapt. It prompts us to do it. It gives us the endorphin factor that we need. However, we need to actually ensure that it's managed effectively and it doesn't tip over, that the bucket has the holes in it that the stress can come out of, so to speak. So we've got to keep it at a manageable level for the individual. So this balance between tension, growth, rest and self-nurturing. Prior to developing the resource for Hinton House, I had conducted some research in the London Borough of Merton with a colleague, Jan Watson, and we had looked at what girls were saying to us as being their key issues and their concerns, because we wanted to make sure that the resource that we produced ultimately as a result of the research really did reflect what the girls and young women were telling us. So we found that they were concerned about bullying, particularly those on the continuum, communication, self-image, relationships, keeping safe online, grooming, risky sexualized behaviors and the risk of being sexually exploited, high levels of anxiety and self-harm. So what we've developed is a programme designed specifically to address these concerns and provide young women with the opportunities to develop the skills they need within the context of a nurturing group. So this is designed to be a group intervention, and it is also ASD friendly with predictable session formats, ASD friendly teaching and learning strategies and opportunities to address individual needs and concerns. So again, this is our award-winning Hinton House publication. And the key aims being to promote personal and social skills development, to promote effective thinking and management of anxiety using tools from CBT and positive psychology, to promote self-esteem, self-awareness, and to give them a sense of empowerment to explore the many aspects of sexuality and healthy personal relationships that they may be thinking about as they reach adolescence, and also accepting personal responsibility for keeping their minds and their bodies safe and healthy, and also giving them the support so that they can access confidently a range of local national sources of information, support and advice, and addressing what we perceive to be the contemporary issues that are relevant to young people and build upon their ability to begin to navigate them successfully. So key features of a resource, basically reinforcement, so allowing many opportunities for overlearning key skills and concepts. The language is explicit, very clear at all times. We use concrete examples to facilitate their understanding. Role play is used to practice key social skills and problem solve. Each session has the same structure and routine, so it reduces anxiety. They know what to expect. Reading others' intentions, so using those role plays to try and develop skills in reading behaviours effectively, and self-awareness. If I don't feel comfortable, what should I do? So using real-life examples of other girls' experiences of being used or exploited due to not reading it right. And then supporting the development of problem-solving skills using structured frameworks. And each session structure is made explicit at the very start. And if there are any tiny changes, they're discussed and prepared for at the outset. And the reason why we call it a group intervention is because it was designed, trialled on groups of girls and young women. And I think this is really, really important. There's something about the power of the group, developing this ethos, developing the commitment around supporting and nurturing and being kind to each other. So developing those group rules, obviously at the outset, is vitally important for any kind of therapeutic type group work, which is what we do. And you can see Amy on the left-hand side here with a lovely smile on her face and a little black t-shirt cardigan, and I'm so proud to have been associated with her and now produced, I think we've produced 3 really good publications to date, so much more to come from us, we hope. So we've divided them into 3 term sets of resources, really, so 3 terms of work. However, it is designed to be used flexibly, but we put it in this order because we think it's just rational to start with the self and our mental health. So the first term really just focus on that. It's all about me, my self-concept, resilience, self-esteem, and then thinking about managing stress and anxiety and looking at self-harm. Term 2 focuses on relationships and communication skills, so non-verbal communication, what that looks like, what it means, verbal communication, relationships, being very, very clear about what our beliefs are, what our controlling behaviours, what we need to be seeking to do in terms of behaving in a respectful, kind way towards others, sexual behaviours, keeping safe online, and looking at the media and the impact that has on us and on our behaviours, and making sure that we have safe profiles online, etc. So again, very, very practical for the girls themselves. And here, term 3, my toolbox for wellbeing and future health is really, really important again. So effective thinking, this is CBT. So very, very important, that connection between thoughts, feelings, behaviours, positive mental attitude, being able to analyze and cognitively restructure negative automatic thoughts using Socratic questioning, relaxation, mindfulness, and setting targets based on a real evaluation. So looking forwards to a better future and making that well-being plan. And the structure of the sessions is really, really explicit. The welcoming, the reinforcement of the group rules, a talk time, icebreaker, core activities, reflections, feedback, target setting for the coming week, compliments to close, and a final relaxation. So again, ASD friendly, the same each time. And of course, ultimately, the key aim of this, from my perspective, is building resilience. So I'm just going to now present a very, very tiny sample from the resource, and you may want to stop and have a go. You may have already purchased this resource and want to actually just take some time to now look through and have a go at some of the activities. So speaking guests, this is within the communication relationships section. So there are a range of different statements which are laminated on 2 pieces of card or paper, and each individual will have to read a phrase out loud and keep in mind what is said in your head. Okay, so the second person listening to person 1 will try to figure out what might be going on in their head. They're saying this, but what might they be thinking up there in their head? So it's about making the distinction between what someone says out loud and then think about what they might really be thinking. But you will find this in the resource. Relationship rules, again, this is one of the handouts from the resource when we're talking about relationships, consent, keeping safe, what's a good, healthy relationship and what isn't. So these are actually key rules or statements that could be construed as rules. So you should only have sex with someone you love. Cheating is okay. You can't trust anyone. Parents always protect their children. Violence is always unacceptable in a relationship. Being jealous shows how much he loves me. And what we really want to be doing here is actually unpicking these statements, talking about what they really mean. Are they really true? Is this really a rule? Is this a healthy rule? Is this a good rule? If it isn't, why isn't it? And this simple activity is from part 3 of the resource, and this is about thinking about my past and my future. So something quite therapeutic about drawing that in those 2 hands or around those 2 hands, all the different things from my past, maybe things that I felt, things that I've experienced, things that are, have been really difficult for me. And then my future, what does that look like? Is there more confidence? Are there more happy times? Am I being more assertive? Am I able to manage my thinking more effectively? Am I ever able to challenge my negative thinking more effectively, etc.? So ultimately, I think we need to think very carefully. Let's just reflect a wee bit more now about why we need this kind of intervention. And I think we probably equally need a boys' curriculum, dare I say it, as well, running alongside this. It's not just about the girls. It's just that my focus today obviously is just on the girls. But I think for all our children and young people, there is this pressure to grow up too fast, too soon. And the sexualisation of both genders has huge implications for well-being, physical and emotional disconnection. And this advertising playing on pseudo-adultness is something that really does need to be tackled and addressed and challenged by us as adults, but also by the young people themselves. And the resource does really focus on building emotional awareness and resilience. And I think this is really, really important, because another issue for many parents and carers, I think, is that they're concerned about talking about self-harm. and they think there's going to be a plethora of it if we suddenly address it in the curriculum. And of course, we know as psychologists, practitioners, professionals, that if it's done properly, then the reverse is the case, and we have demystified it. And what we're actually doing is trying to help children, young people, really understand why people engage in these behaviours, how it can best be managed, how it can best be reduced over time, and how to actually increase our level of effective thinking and management of anxiety so that we don't begin to engage in these behaviours, or we engage in them less frequently. And learning to cope better with the emotions associated with self-harm can help to reduce or stop it. So if we're educating around that, and we focus on increasing coping and resilience, I think that is what really, really can lead it to being something that is saleable to parents and carers, and something they need not be fearful of as an intervention. So teaching emotional literacy and awareness creates a platform for raising some of these difficult topics: self-harm, childhood sexual exploitation, eating disorders, etc. And I think it's really essential. It has to be part of our wellbeing curriculum, and it makes it more palatable, again, for teachers, parents and pupils alike. So we can build up to educating around self-harm, I suppose, is what my argument is, by learning to recognise a range of difficult emotions: anger, stress, pressure, etc., and discussing positive and negative coping mechanisms. And those lessons that build resilience really do have the power to simultaneously minimise young people from starting to self-harm. And it also destigmatises those that do, helping them to feel less isolated, more able and willing to access appropriate support. We also need, as adults, professionals, to challenge and tackle sexualisation of children and young people. And the American Psychological Association does highlight positive alternatives, and really talks about the need to have school-based media literacy programs, which are, I think, key to this, teaching critical skills in viewing and consuming media. So again, looking at those images, and we do include these in the ASD Girls Wellbeing Toolkit. Girls and boys groups can also work themselves towards change, and alternative media, which there is a lot of, such as web-based magazines and blogs, feminist magazines, books and websites, can really encourage girls to become activists and develop their own alternatives, which I think is absolutely vital. We want the girls and young women of the future to be those that can do this, that can become really active and develop alternatives that are much, much better than this. So what do we need when we know that the in-house support is difficult, it's thin on the ground, the money's not there? Mental health leads are having to probably take on 4 or 5 really, really key roles within the school alongside other duties, not anything to do actually with their mental health lead role. So I think we need to be really careful that we do develop the in-house skills, that we really ensure that all staff feel confident and competent in really ensuring that they can support the well-being of girls, that they themselves have reflected upon their behaviours, their narratives, their thinking around these critical issues, such as sexualisation, stereotyping, consent, etc., the stuff that girls need to feel secure, that the adults around them know and will support them in pursuing the right avenues, those that will ensure their well-being. We need to actually make sure that we have staff in school who are available to do this, to really also early identification, to develop those systems so that we can identify the girls and young women and boys who are going to be most at risk and need more support. We also, I think, as adults, need to ensure that we're interacting more therapeutically and tackle the stigma, not just around having specific labels, but the stigma primarily, from my perspective, around having issues around your mental health and well-being. And just starting, with thinking about how we challenge some of these issues, some of these belief sets, some of these ideas that this is what is a perfect role model. Why would you think it is? Why would you think she isn't? What makes Victoria Beckham a role model? What makes her a good role model? Or, dare I say it, a bad role model? So I don't actually give the answers here. I ask the girls themselves to come up with what they think. So would Beyoncé, for example, be a better role model? Would she be someone that I would think you should aspire to in terms of behaviour, in terms of success, in terms of compassion, in terms of being a good person? And is this a result that we want? Is this something that we should be aspiring to? What do they think about this particular image? Do they think this is an image which portrays someone who's happy, content, who is confident in herself? Or is this an image of someone who is frightened, who's scared, who needs some support? And is this a better result? This is the new Ralph Lauren plus size model. Is this what we should be aspiring to? Why is this plus size? What do the girls themselves think? Not what do we think? I'm passionate about girls' well-being. I've worked with girls and young women for so many years, and sad to say that I think that the issues are more complex than ever and the pressures are greater than ever. And I think that for both our girls on the continuum and those who are not, it's just too important for us not to act now in terms of really protecting their well-being and ensuring it going forwards. We need to make sure that we have appropriate interventions at school-based and home or social context level, at all of those levels. And we also, as adults in schools working with young girls and women, need to be able to work more therapeutically with them to ensure a preventative approach and that the interventions are really appropriate, fit for purpose. So using the wellbeing toolkit that we ourselves develop, ensuring that our understanding of therapeutic approaches permeates our approach overall. We also need to tackle media influence and the pressures of growing up in this 24/7 surveillance of social media and smartphones, and ensure that the young people themselves have a voice. What is it that they are telling us that they need? Where is your wellbeing survey for your girls? Asking them what are their concerns, what do they want, what do they need in terms of an intervention, support systems in the school context. I think they can tell us what the real issues are, and we can support them to lead fulfilling lives. I think, isn't that our job? Yeah, of course it is. So thank you for listening. I hope that this has been useful. I hope it's been given you some food for thought and some time perhaps to reflect on maybe your own views, your own experiences, and also going forwards how you may be thinking about developing bespoke programs, particular interventions for the ASD girl and girls in general in your educational context. So thank you very much for listening, and I hope you join me again next time.